Mr. President, I come to the floor today as someone who has practiced medicine, taking care of families in Wyoming since 1983. And again, this weekend, I was home in Wyoming visiting with families across the state. I was in Thermopolis for Father's Day. I was in Sheridan and in Casper. And in all of those communities, I've had a chance to visit with people who are concerned about the direction of the country and are concerned about this new health care law. And, Mr. President, I tell you this because I ran into a number of people who I have taken care of as their doctor. And this happened at church on Sunday morning, where people asked the question, with this new health care law, will I be able to keep my doctor? And so, Mr. President, I come to you because there is more news as a result of the changes in the health care law in this country. And I bring to you my doctor's second opinion as to what the impact of this health care law is going to be on the families across the country. Specifically at church, hearing from someone who I'd operated on and somebody on Medicare, and they're saying, am I going to be able to keep my doctor under Medicare? And this person has a right to be concerned. And it's because of what has come out in this past week, Mr. President. It is a front page article, USA Today. Doctors limit new Medicare patients. Doctors limit new Medicare patients. Well, you know, I have said from the beginning, Mr. President, as this body was debating and discussing the health care bill that has now come to the law, that I believe this was going to be bad for patients, bad for payers, the American taxpayers who have to pay for the care, as well as people who pay for their individual care, and bad for providers, the nurses and the doctors and the hospitals that take care of all of these patients. So I come to you with a second opinion because I think that what has become law, a bill that cuts Medicare, cuts payment for our seniors on Medicare by $500 billion, not to help seniors, not to help save Medicare, but to start a whole new government program for other people, is resulting in devastating impacts for families all around the country who are on Medicare or will soon be on Medicare. And one of the interesting things about this article in USA Today, and this was Monday's USA Today, Mr. President, there's a list of the number of people, a table of the number of people who are currently on Medicare and who will be on Medicare by the year 2015 and will be on Medicare by the year 2020. And what we're seeing is, as Americans are living longer due to advances in medicine, advances in technology, people are living longer, more and more people every day are turning Medicare age, so the number of people on Medicare continues to grow. As a matter of fact, if you do the math, Mr. President, there are over 4,000 Americans every day being added to the Medicare ranks. That is almost 1.5 million Americans a year. And the question is, who will the doctors be? Where will the health care providers come from to take care of these people? Well, the article, and it's fascinating, Mr. President, when you read this and you see the complete disconnect between Washington and the reality of the rest of America. Because according to this article, the people from the Centers for Medicare and Medicaid Services say that 97% of doctors accept Medicare. So don't worry. That's what the Centers for Medicare and Medicaid say. Well, the American Medical Association says 17% of over 9,000 doctors who were surveyed are actually restricting the number of Medicare patients in their practice. Now, among primary care doctors, which are key for our seniors to be able to see primary care doctors, 31% of primary care doctors are restricting access to Medicare patients. And just since the first of the year, in North Carolina, 117 doctors have opted out of Medicare. That doesn't include the ones that had opted out before. We're talking since January 1st, 117 doctors in North Carolina have opted out of Medicare. In Illinois, in the president's home state, 18% of doctors restrict the number of Medicare patients in their practice. And in New York State, about 1,100 doctors have left Medicare. Now, even the president of the Medical Society of New York isn't taking new Medicare patients. No new Medicare patients. You say, why are these people, these physicians, no longer taking Medicare patients? Well, it has to do a lot with the way that Washington deals with Medicare patients, Medicare, and the doctors around the country. Right now, at this point, there's going to be a cut of 21% in what Medicare pays doctors for services that they give. And prior to that, Medicare always has been kind of a deadbeat payer when it comes to paying for health care. Medicare has not kept up with medical inflation in this country. So it's a challenge to be able, as physicians, to take care of patients on Medicare. And with 4,000 new people joining the ranks of Medicare on a daily basis, who will care for these people? So you can imagine, Mr. President, I was fairly surprised when the President of the United States yesterday visited with a number of people at the White House. He put out remarks printed from the White House and talked about what his new plan does. And he said that Americans will, it's astonishing, the President of the United States yesterday said Americans will be able to keep the primary care doctor or pediatrician they choose. He says these protections to preserve America's choice of doctors. Well, Mr. President, what happens if your doctor can't afford to keep you? So you have the President of the United States who for well over a year has been making statements like the one he made a year ago, if you like your health care plan, you'll be able to keep your health care plan, period. That's what the President said. He said no one will take it away, period, no matter what, period. But yet, Mr. President, here we are looking at the fact doctors are limiting new Medicare patients, 4,000 new patients every day joining the Medicare rolls, looking for doctors, and we see it all across the United States. That's why the public remains very skeptical about this new health care law, and why 58% of Americans want this law repealed. And that's why, Mr. President, the American people, when they heard Nancy Pelosi say, we have to pass the bill before you get to find out what's in it, why the American people, who are now finding out what's in it, are very distressed, because they were hoping to take the President at his word when he said he was trying to lower costs and improve quality and increase access to care. But this body did not pass a law, did not pass into law, nor did the House, a reform package that will do those things that the American people had wanted, had asked for, and had heard from their president that they would get. Something that would lower cost, improve quality, and increase access to care. What the American people are seeing is that the cost of their care is going to continue to go up, and the quality and the availability is likely to go down. That's not what the American people asked for in this health care law. That's why so many Americans are opposed to it. And it really has to do, when I talk to people all across Wyoming, they think what the impact is going to be on their own lives and their own care and their own family. And people all across this country are worried that for their own health care, they're going to end up paying more and getting less. That's why the public remains very skeptical about what has been passed into law. 20 states, as you know, have filed suit against the federal government because of a national mandate that people have to buy insurance. And the Department of Health and Human Services, which says 97% of doctors are still taking care of Medicare patients, there's been a new nominee to take care of that department. Haven't had hearings yet in the Senate. Haven't seen that to be able to ask those specific questions of that nominee. What about taking care of these patients? How will they find doctors under this new law and this new plan? So here we are, Mr. President, now 90 days after the health care law was been enacted, signed into law. 90 days ago, this has become law. The White House holding press conferences and again repeating promises to the American people know have been broken. There is a litany of broken promises, and it just seems, Mr. President, that every week something new comes out that the American people look at and say, you know, it's amazing because we saw this coming. And yet this Congress, this Senate, jammed through a bill that isn't going to provide better coverage. It's going to jam 16 million more people onto Medicaid, 16 million more onto Medicaid. And Mr. President, we know that almost half the doctors in the country don't take Medicaid patients. Now we're seeing more and more people as physicians, hospitals, saying, how do we keep the doors open with what Medicare is paying? So as fewer and fewer physicians are willing to take care of patients on Medicare, limiting their practices on Medicare and on Medicaid, and Congress now stymied with what is known as the doc fix, huge cuts in reimbursement to doctors who take care of our seniors. It's going to be increasingly difficult for the American people to be able to find a doctor. And that's why, Mr. President, I come to the floor with my second opinion about this health care law, telling you it is time to repeal this legislation and replace it with legislation that delivers more patient-centered solutions, delivers more personal responsibility, more opportunities for individuals who take control of their own health and their own care, which is what I tried to do as the medical director of the Wyoming Health Fairs, giving people information they can use to stay healthy, to keep down the cost of their care, because half of all the money we spend in this country on health care is just on 5% of the people. There are patient-based solutions, allowing people to buy insurance across state lines, giving individuals who buy their own health insurance personally the same tax relief that the large companies get when they pay for health insurance, deal with lawsuit abuse, allow small businesses to join together to lower the cost of insurance, provide individual incentives for people who do take personal responsibility for their own health. Those are the things that will actually help get down the cost of care. Those are the things that will help Americans stay healthy. But they are not, Mr. President, in this health care law that has been passed by the House, passed by the Senate, and signed by the President. And that is why, Mr. President, I come to the floor this week, as I have week after week since the law has been signed, to offer my second opinion, and that opinion is it is time to repeal and replace this health care law with a law that will work for the American people. Thank you, Mr. President. With that, I yield the floor.